Secretary Miller. Um, Glad to have you back. Department has reported a 19% reduction in calls to the child abuse hotline during the COVID-19 pandemic. And with children not being in school, they're not regularly seeing their mandated reporters. Schools have also reported an uptick in truancy, even with virtual schooling. So meanwhile, our hospitals have been reporting that the cases of child abuse that are presenting in their emergency rooms are more severe than they had previously seen pre-pandemic. So I'm hoping that you could please give us an update on the status of our Commonwealth's most vulnerable children.
Sure, and thank you, Senator, because this is such an important issue. And we talked a little bit earlier today about this issue and, you know, the fact that having kids not in school, so many mandated reporters are in the schools, and that is typically who oftentimes is calling Childline and making us aware of instances of child abuse or neglect. And we did see, you know, initially in the pandemic, we saw in those initial months a 40 to 50% decline in Childline calls. The good news is that's gotten better. And as you pointed out, I think we're now in the 22% less reports. So it's gotten better than it was initially. But part of that is we've been trying to do a lot of press calls where we talk about this issue. We've been doing education with our stakeholders and really making the public aware that we all have a role to play. We can't just rely on mandated reporters. We all need to make sure if we see something, we say something and we make that call to Childline. And I don't know if Deputy Secretary Rubin would like to say more on this. He's certainly been on the front lines here, but this has been something that has been very much weighing on our minds.
Yep, and I very much also appreciate the question and the opportunity to speak. I do want to say we have tracked this closely and really ourselves trying to think about what has been the impact of COVID on keeping kids safe. It's what we do every day. And we've talked pretty regularly with our county partners. I think we have to acknowledge that as a county administered system and the county's doing a lot of the direct service work and direct supports to families, it's really a partnership with us and working with the counties to help make sure that they are getting the word out, to help make sure that they are still seeing kids, that they are still responding to reports. We've developed very specific communications back and forth with the county so that we can track their staff capacity and making sure that also they were fully staffed as well. So throughout the pandemic, we very much had kept the focus on trying to keep kids safe, recognizing that the reports were down. And again, as Secretary Miller has said, we've been tracking the reports daily. And I'll just make a comment quickly to everybody that we are working on our 2020 annual report. We know we are due to give an annual report to the legislature in the near future, which will give all the data around the drop of reports and really to help us analyze a little bit about what has been the impact of COVID on child safety in Pennsylvania.
Thank you. I will look forward to receiving that report. And if I could tie this back to our budget, we've got a large number of state employees in the Department of Human Services under the government's jurisdiction who are teleworking from home. And it appears that you're asking for an additional $1.14 million for new space for Childline, the Office of Children, Youth and Families Regional Office, and the Bureau of Financial Operations. And so my question is, have you been working with the Department of General Services to see if they have any freed up space that you could potentially utilize without having to spend those additional funds? I imagine that some people will continue to telework for a period of time, and this could be a potential cost savings for your budget.
Yeah, I appreciate the question, Senator, and it's a good one. The current offices for our Childline and OCYF regional offices and Bureau of Financial Operations, they're currently housed on the former Harrisburg State Hospital grounds, which of course is now being sold by DGS to the Dauphin County Redevelopment Authority. So our new building has been designed to accommodate the safety and health of our employees, some of whom work manning the Childline Center 24/7. Our new facility also has the appropriate HVAC filtration to address air quality issues, including COVID-19, significant security improvements for our overnight workers, including those emergency call stations in the gated parking lot, an advanced public address system, and an interior camera system. To your point about did we work with DGS, we don't have a permanent teleworking policy in place right now, but we do know that when we come back from COVID, we will need a space for these employees. And we did speak to DGS, talk to their leadership back in 2018. And in their role as both a portfolio manager for Commonwealth owned and leased space and administrator of capital funds projects, they reviewed the requirements and the timeline against all three options for space available. And they looked at reuse, reallocation of existing vacant space, new building through the capital planning process, and leasing space. And based on the requested requirements at the time, DGS determined that there was not existing space to be reused or reallocated to meet our needs in the existing owned and leased property portfolio.
Thank you, Secretary. And I understand that there are specific needs for these types of services, but I will say this, so much has changed since 2018, and I certainly expect that we're going to have a lot of office resources that we may no longer need, and if there are efficiencies that could be found there, that would certainly be a great way to reduce costs, find savings, not impact programmatic offerings. So I thank you so much. Thank you, Mr. Chairman.